Let's get started. Thank you very much, everyone. And hello, my name is Addy. Welcome to the 4S Roundtable on preparing for reopening in Ontario, the Occupational Health and Safety and Employment Standards Act requirements. And on this virtual roundtable, first, I'd like to thank our government panelists, Ron, the Chief Prevention Officer of Ontario, Jules, the Director of OHS branch of the Ministry of Labor, Training and Skills Development, and Melissa, the Director of Employment Standards Act. Thank you very much for taking out time and making it today. And I have to thank our industry partners, the one who's smiling on the screen there, Tony and Fatima from ORMA, which stands for Ontario Restaurant, Hotel, Motel Association. Thank you very much, both of you. Without your participation, this wouldn't have been possible, and the government panelists as well. And there are many people who are clients of 4S on this call, but there are also many employers who are not our clients who have no idea of what 4S is. And so I'd like to explain just briefly. 4S Consulting Services is a Canadian company, Canada's leading occupational health and safety training, consulting, training, and software company. So we support small, medium, large, and Fortune 500 companies with their OHS compliance requirements and help them stay in compliance. So in consulting, we support our clients with ISO 45001, the certification, and then core certification of the IHSA, WSIB Excellence, which we tie into our SME health and safety program, and customized OHS consulting services. In training, we are Chief Prevention Officer approved training providers for JHSC e-learning, which is the part 1, 2 days, which is not 3 days anymore. So you can do it in 2 days and save a day. And part 2, which is the virtual learning, where you will have a tete-a-tete with an instructor live. And we are also approved for blended working at Heights. Along with that, you can use our online system for 80 plus online trainings. So that brings me to, in systems, we have a proprietary online system called 4SafeCom, which is used by 600,000 plus workers across Canada for inspecting their workplaces, for training, and for various reasons. So we constantly partner with the government and industry leaders to help employers such as you who are on the webinar today with insights on various aspects of occupational health and safety, which has become a must today, given the pandemic and that we are reopening. And that's why thank you to all our panelists to make it to this event. So quick 3 checks. This event is for you. This webinar is for you, the employers. You are the ones who need to benefit from this. We want you to engage with us. We want you to ask us questions. There are some experts from the government. There is an industry representative of the hotels. Tony Ellenis is the voice of all the hotels that are on this call. And all the other employers, ask your questions in the question and answer box. There is a Q&A box, as you see at the bottom of your Zoom screen. Put in your questions. We'll be constantly monitoring them. And we have a 15-minute segment reserved for Q&A right at the end. We'll take as many questions as possible. And if not, we'll rest assured take them offline. And these are non-anonymous. We would like you to give your name so that we get your question, let's say, to Ron, and then get your question back, or to Jules and get your question back to you, the response back. Thank you very much. And this webinar will be recorded. And the reason for that is there are many employers such as you who are not able to make it today because of their busy schedules. It'll be displayed through our partner network to them and to everyone after the approvals of the government panelists. Thank you very much, everyone. So our moderator for today from 4S Consulting Services, Inc. is Sobi Raghunathan. Sobi has been supporting diverse Canadian businesses of different sizes in implementing and maintaining sustainable OHS programs, occupational health and safety programs. Sobi is an IHSA Associate External Core Auditor. Along with that, Sobi is an ISO Lead Auditor for the 45001 Occupational Health and Safety certification. Part of the League of Champions, Sobi works constantly with the industry to promote safety leadership. And during the pandemic, Sobi leveraged the technological and innovative capabilities of 4S to develop free online trainings to help businesses such as you not only comply with the occupational health and safety requirements, but to keep your workers safe. And she also sits on the board of governors of the Ryerson University. Without any further delay, let me pass this over to Sobi Raghunathan. Thank you very much.
Thank you so much, Addy, for the nice and quick intro. I do want to welcome each and every one of you who have signed in today to listen to our government officials, and our intention is to give you the right context to safely reopen and keep our workplaces safe to minimize any workplace spread of COVID-19. And we have great support from our government panelists who are here, as well as Tony and Fatima from OGMA. OGMA is one of the Hotels and Motels Association, Hotels, Restaurant and Motels Association has been one of the major associations that they are facing the impacts of COVID-19. And there has been many employers who have been affected and trying to safely reopen. So we do want to hear from them in terms of what are some of the challenges and what kind of support are they giving to their employers. So that being said, I do want to welcome our Chief Prevention Officer, who is always ready to roll up his sleeves to participate in many webinars, to give out the right context and the information. We are so happy to have such an engaging Chief Prevention Officer, Ron Koloski. Thank you so much. And I guess Ron doesn't need a good intro because everybody knows Ron. Ron has participated actively in supporting the various different industry partners. So just to formally introduce Ron, Ron oversees the prevention within the Ministry of Labor, Training and Skills Development, and has a wide range of responsibilities, including working with Ontario's health and safety system partners to prevent workplace injuries, illnesses, and fatalities, monitoring the performance of Ontario's occupational health and safety, and setting province-wide training and safety program standards. Under his leadership, the Prevention Office has supported workplaces in Ontario to implement health and safety measures during the COVID-19 pandemic. This includes working on cross-government industry committees and producing hundreds of workplace guidance resources. Before I hand it over to Ron, I do want to welcome Jules Ansquet, Director of Occupational Health and Safety, and Melissa Faber, Director of Employment Standards. It is a great pleasure to have all of our panelists, and I know we have over 150 participants who have logged in to actually hear some of the insights that you're going to give us to safely reopen Ontario. Ron, I'll pass it over to you. Thank you so much for joining us today.
Thank you, Sobi, and thank you for us for sponsoring this. Welcome my colleagues, Jules and Melissa. They will have very important information to pass on. And thank you, Tony, for working with us to get this off the ground, especially in a pretty timely way. As you know, the government has, we've moved over the past week and a bit into the first phase of the three-phase program. And I'm sure you've heard that imminently we may be moving into phase 2, then followed by phase 3 if all of the numbers are aligned. As Sobi had indicated, our role has really been to help essential business through this whole COVID program. And we've developed, and they currently reside on the ontario.ca/COVID-19 website, over 200 and some odd guidance materials covering a wide variety of industry. It's been viewed about 1.5 million times, and these guidance materials can help people as they try to understand the implications of working in an environment where there is a pandemic present, in an environment where you have public health requirements, you have government requirements under the Reopening Ontario Act, and then you have the Occupational Health and Safety Act, and what are the requirements under that? Because remember, public health is public health, but the Occupational Health and Safety Act is fairly specific when it comes to the employer responsibilities. We have a number of general resources available to you that's especially businesses like the hospitality, the restaurant, hotel and motel associations, those industries that have either been shuttered for a period of time or because of the up and down nature of the opening and closing, many of their employees who kind of knew the ropes, if you will, are no longer in the industry, and you're working with new employees. And what is the responsibility of the employer? What do I need to know? We do know that with the reopening on phase one, that patios were opened with certain restrictions. What are the responsibilities of the employer to ensure the protection of the worker? What are the masking? What are the face shield requirements that are necessary? What do I do? How do I trace people when they come to my establishment? How do I ensure that my employees are COVID free? What about active screening? All of this information is available on the COVID-19 website and will be made available. I believe Sobi and Tony, correct me if I'm wrong, that through convenience, the association has put all this information available for you so that it will cover both outdoor and, I guess, indoor dining requirements. We have what's called a safety plan. Every employer is required to do a safety plan, and we have a safety plan builder and checklist that is available on the COVID-19 website to help you as an employer understand what you need to do to stay safe. And this safety plan looks at the risks that are inherent within the organization, number of people that can be safely allowed within the parameters of the guidance that is within the reopening plan. We will be moving to we're at 15% for retail. We will be moving to 25% as an example when we move to phase two. It also provides information on what is known as the hierarchy of controls. How do you eliminate the risk? Not always looking at the mask or the face shield as being the last bastion of trying to avoid transmission, but it talks about how the vectors of transmission occur. It is generally, when we started out, as a droplet format, but there is concern that it may be aerosolized. The vectors of transmission can include through the mouth, through the nose, but also through the eyes. And so in areas such as dining establishments where you have a server coming in contact frequently with different people who may not be wearing masks and are sitting at a table and talking, there is a concern about aerosolization. So it's important that the proper PPE be used, a mask and a face shield as an example, to avoid transmission. We're also, if you stay tuned, we're also providing supports to small business, certainly adding to the information flow, but businesses that have between 5 and 19 employees. There was an announcement in the Ontario budget in March that we will be making available programs to small business that will be supported through rebates and subsidies by the government, and there will be more information coming out on that over the next few weeks. And that's particular to the training associated with the Health and Safety Representative Program, which under the Occupational Health and Safety Act, organizations between 5 and 19 employees are required to have a trained representative. So there will be information on that to support your businesses as you reopen, so you're not out of pocket for the training. We also have produced information on two things. One is vaccinations in the workplace and rapid screening. Now, the guidance document explains how vaccinations work to protect you when you're vaccinated, why COVID-19 workplace control measures are still needed to be maintained, even though you have a worker that may have had their first shot or in some cases their second shot, and some considerations for employers about workplace policies supporting their workers to get vaccinated. Jules will probably speak to the fact that OSHA will stay silent when it comes to whether or not vaccinations are mandatory. what we encourage employers to do is to educate their employees on the importance of vaccination. There is material available on that so that you can in the morning before you open, you can have your employees in a room and you can talk to them about, if you want information on vaccinations, here's where you can find it. We try to suggest that communication helps dispel some of the myths. There are certain people that are fearful of vaccinations, but there are also people who cannot take the vaccination under the Human Rights Code. And we are explaining to people at this point in time that in settings where you have such variability, like the number of people that are coming in to, let's say, your cafe or your outdoor facility, and the frequency of contact between your servers and those people, that we maintain the current level of vigilance when it comes to infectious prevention and control procedures, good hand hygiene, cough and sneeze etiquette, cleaning and disinfecting on a frequent basis, and again, the importance of your masking and eye protection. We also, Melissa will also tell what supports are available through the Employment Standards Act. If infectious disease emergency leave is required, that will be all rolled in. We also suggest too that in the case of that screening be continued, especially as an employer, that you maintain active screening. And what I mean by that is that you go through the steps to ensure that people, have not been out of country, have not been exposed to people that have, symptoms, are not exhibiting any symptoms, etc. There are applications that are available. You can also take advantage of what's known as rapid screening, which is available through your local Chamber of Commerce. And the Chambers of Commerce are issuing out free kits where you can test your employees twice a week to determine whether or not they exhibit asymptomatic. If they're asymptomatic, this test will, within about 75 to 80%, determine whether or not they have the COVID virus, and they can go and get a full PCR diagnostic test. We have been using rapid screening since November in a number of industries, and we've had actually the Ministry of Labor, which looks after predominantly construction, we have over 300 firms and 470,000 rapid tests have gone out. When I say it's got about a 75% accuracy rate, that means on a false positivity accuracy rate, meaning about 25% of the time it can identify a person that may have symptoms, but the PCR test will include, will screen them out and say, no, they are not symptomatic. So we do have a host of materials available to you. Tony and his association and SOBI, in conjunction with SOBI, there is a lot of materials out there. There's a lot of materials in multiple languages available for you, and we would encourage people to take advantage of that. We have also other programs as people kind of move out of the pandemic and we're into a bit more of a normal state. Some of the larger facilities may want to take advantage of some of the programs that SOBI had indicated, the Health and Safety Excellence Program or an ISO program, where you can receive further rebates in your WSIB premiums and rebates through the Supporting Ontario Safe Employer Program, which is through ourselves at the Ministry of Labor Training and Skills Development and the WSIB. So on that, I think I'm pretty much done, and we're saving questions to the end, I believe, correct?
Yes, Ron, thank you so much. That was really helpful and insightful for many. I see there's over 5 questions that have been submitted, and you have already touched upon some of those questions in regards to vaccination policy and rapid screening and testing. So just to recap what Ron was saying in regards to vaccination policy, the ministry cannot tell you what you should do and you should not do. Am I correct in saying that, Ron?
Yeah, we are not. It is an employer decision with respect to understanding what the role and responsibility of the employee, the human rights code, privacy considerations, and so on. So, we will provide guidance, but we don't take a stand on whether it's mandatory or not.
Perfect. Thank you for clarifying that. Because of the human rights issues and everything else that's involved, it is an employer's discussion to come up with your own policy for vaccination. And you can continue to have discussions and awareness sessions provided to your employees, but the government is not, especially under the Occupational Health and Safety Act, and the standards, as well as Employment Standards Act, they're not going to be enforcing vaccination as part of it. So that should set some clarity for employers who are looking for some sort of a direction when it comes to vaccination policy. And do talk to your legal team. I'm sure many employers do have your legal team, or your lawyers do get to seek their advice in terms of how you should draft your policy. And Ron did touch upon many interesting points in terms of various different programs that the MLTSD is working on, especially for the SME, small, medium-sized businesses. And he touched upon the safety reps training that's going to come. We will stay tuned for more information on that. And we will be taking the questions that have been submitted. There are 15 minutes allotted towards the end of the session for questions. And some of these questions are already being addressed as part of the presentation. So that being said, we will move to the next discussion with Jules Ansquet, Director of Occupational Health and Safety Branch. The Occupational Health and Safety Branch develops compliance, assistance, and enforcement strategies for programs under the Occupational Health and Safety Act, and provides strategic and technical implementation support to the field and the ministry. Jules joined the Ministry of Labor in 2005 and has progressed through the variety of roles. He began as an industrial health and safety inspector in the Western region, and since then has several positions in the ministry in the Operations, Policy, and Prevention Division. It is a great pleasure to have you, Jules, and I know you joined us a few months back to give us more context into what some of your field staff are doing. And since then, we have been hearing a lot of great things that came out. And I know at one point you guys were focusing on the big boxes and all the shutdowns that was happening in workplaces where they were not complying with the COVID policy and the safety plan and the guidance. So if you can expand on that, we would greatly appreciate that, Jules. I'll pass it over to you. Thank you so much for joining us today.
The joys of technology. Okay, so yeah, if we could go to the next slide, please. Or do I have control? No, okay, perfect. So I won't go through all of this, but just to show you that we've been quite busy, as you can imagine. The pandemic has really changed the landscape of our normal day-to-day work. We normally are focused, about 75% on what we call proactive work, which is, we're picking hazards, musculoskeletal disorders or, guarding or other topics. And each year we, work with partners to, put out guidance and compliance assistance materials. And then we do, initiatives where we focus on different workplaces based on the data. But almost 100% of our capacity has been focused on tackling the pandemic, just because we've been a key, boots on the ground part of the province's strategic approach. So we've really been working hand in glove with our colleagues at Ministry of Health and the Chief Medical Officer of Health, local public health units, to make sure that all of us are working together in collaboration and on being on the same song, singing from the same songbook, basically, on, how do we help businesses who are open stay open safely, and how do we help businesses who have been closed and then they reopen? How do we help them reopen safely? So that's our main goal. So a lot of our work has been really focused on a compliance assistance and educational approach. And then, as we go on, we do end up ramping it up if we find concerns of concerning non-compliance that continues, but we don't start that way because we know that for almost every business, this is brand new. Many of you have for years successfully done risk assessments on what are the hazards in my workplace and what kind of controls do I need to put in place. But outside of healthcare workplaces, most of us didn't think about infectious disease hazards because it wasn't something that was regularly day in, day out in our workplaces. And COVID has changed that landscape. So between our colleagues in prevention division, where Ron is the chief prevention officer, creating those supports and guidance, and then our inspectors going out there really trying to communicate the message about what is it that you can do if you're open to be open safely. You can see we've gotten a ton of public inquiries, and they're not just OHS. I've got my colleague Melissa here. You can see a huge amount of employment standards calls. That's to do with all of the people that are out of work, probably having questions of what does this mean for me, or do I get paid sick leave, or all the other kinds of questions. So it's been a huge push to answer questions for both health and safety and employment standards. And the main thing I want to point out to this slide is that really to increase that presence on the ground, to make sure we're out there in as many workplaces as possible, helping them be open safely, we've had to expand how many boots we do have on the ground. So we have over 400 of our own health and safety inspectors. Last year, the minister announced the hiring of another 100, which we hired in January, and they're currently in training. They're not yet out there on their own yet. We expect that later this summer. And then even so, though, we needed more people to really be out there checking on not just occupational health and safety, but the Reopening Ontario Act, which is, the act that sets, whether you, what step you're in, or what's open and what's closed, what capacity limits are, all of those things. And basically every provincial offences officer, no matter what ministry you work in, has been authorized to enforce the Reopening Ontario Act. So we've been a key part of the training and the organization and the deployment of that, given our expertise in managing large inspectorates. So you can see on the right of the slide here, like we've had I think it's over 500 now, provincial offences officers from other ministries supporting the enforcement of the Reopening Ontario Act. So they're not doing OSHA, that's only inspectors that can do that, but out there checking on the ROA. And so that's been another key thing. You see on the left side in the middle there, we've also had Technical Standards and Safety Authority out there doing over 12,000 visits. We've got 60 plus employment standards officers who've been authorized under OSHA to visit workplaces. They're not enforcing, they're there to help. They're doing compliance assistance and education. We really wanted to get as many resources as we could on the ground to help workplaces, because we know for most of them, it's like, I don't even know where to start. And so that's been the key focus from the beginning of the pandemic. Next slide, please. So really, why are we out there? Obviously, we're enforcing the Occupational Health and Safety Act. And so infectious disease hazards are hazards that fall under the Act. Even if it's not explicitly mentioned, it falls under what we call the General Duty Clause, which is an employer shall do everything reasonable in the circumstances to protect their workers. And so a pandemic meets that criteria. So a key visit is when we show up at a workplace is, hey, what are you doing to help keep your workers safe? Walk me through what you're doing. And there's a whole rack of ways that they can do that. And so we don't prescribe specific things you have to do. There's no specific regulatory requirements with regards to infectious hazards in most workplaces. But we do say, what is your plan? What do you have in place? And we talk through the things that we expect you to do, what we consider reasonable. We're also, as I said, enforcing what we call the ROA, the Reopening Ontario Act. That's the legislation, again, as I mentioned, that says, can you be open? Is a restaurant allowed to be open or not? What's the capacity limits? Are you doing active screening? All of those things. So we look at both during our visits. The main piece is about communication and working with partners to help get the word out there in order to support workplaces being open. We want workplaces to be open. We just want them to be open safely. And really, it's always, as always, with OSHA about the IRS, the Internal Responsibility System. You're best placed to open your workplaces safely, and we ask you do it in consultation with your workers, with your Joint Health and Safety Committee, et cetera, so that you can make a solution that works for you and your business. Next slide. Okay, thank you. So I mentioned this briefly, but it's kind of been an unprecedented era of partnership for us. We always partner with colleague ministries and with other entities and organizations, but this has been absolutely imperative during the pandemic because viruses don't care whether, is this public health or occupational health? They don't care, is this provincial or federal jurisdiction? They don't care if is this a local public health unit's role or is this the Ministry of Labor's role? And so what we've had to do is really coordinate, communicate, and have new data sharing agreements at all three levels of government. So we have now, daily outbreak data we get from Ministry of Health. We have daily outbreak data we get from the Ministry of Long-Term Care. The federal government shares all of the data with regards to when temporary foreign agricultural workers are arriving in Canada and what farms they're going to. So this has been a real, if there's a silver lining to the pandemic, it's that it's the way people probably think government should work, in the sense that we break down silos, we work together, we partner, we try to not show up at the same workplaces with two different regulators. All of that has been something that we've been working on during this pandemic to make sure we have the greatest impact and are really supporting businesses rather than being a burden to businesses. And we're continuing to try to improve on that. So next slide, yes, please. Okay, so what's different? So what's different than normal? Well, really, we're just really trying to raise awareness, and it's all about the main focuses is screening, personal protective equipment, masks, face coverings, eye protection in some cases, and really about what's your plan? What's your workplace safety plan? Under the Reopening Ontario Act, we had started with saying you should have a plan under OSHA, and the Reopening Ontario Act, they loved that idea so much that they actually required it. So every workplace is required under ROA to have a written workplace safety plan. But we know that a lot of you may say, well, I have no idea where to start. I don't know how to create a workplace safety plan for infectious hazards. And so Prevention Division has done an amazing job creating a suite of tools that really, it's kind of like paint by numbers, 6 questions that walk you through from beginning to end to create your own safety plan. And there's videos out there and there's a whole bunch of resources. So I encourage you to look at those if you're not familiar with how to create a safety plan. It actually really is almost like risk assessment 101, teaching you about the hierarchy of controls and how to look at risks. And you could use it for any risk. So post-COVID, I encourage you to use that kind of thinking going forward. And then lastly, physical distancing, of course, that's a constant one we're focusing in on and asking people, how are you keeping physical distance in your workplace? Next slide. Okay, I mentioned the safety plans. It must be available to any person upon review. And while we're finding, a lot of the majority of workplaces have safety plans, unfortunately, we're still showing up at way too many that do not have them. Again, so I encourage you, you have to have a plan. You do not have to use our template. The template is there to help you, but you need to have some kind of plan of what are you doing to keep your workers safe. And that is something that will be asked every time someone shows up for the Reopening Ontario Act inspections, visits. They're going to say, can I see your safety plan? So I really want to encourage you, if you do not have one, please make sure you get one set up. Next slide. Again, what's different? This one is still new to a lot of people, but an eye protection requirement. We now require, as a reasonable precaution in the circumstances under the Occupational Safety Act, that if you're within 2 meters of somebody as a part of your job, and even if you're both with a mask on, you need to have eye protection on. So this is really important because a lot of people are like, if we both have masks on, they think they don't need eye protection. This is a new requirement. It came out about 2 months ago, and this is because of the variants of concern. Earlier in the pandemic, we did not require this because we did not see the eyes as being a significant area of infection. But the variants of concern, while they don't transmit differently, they much less viral load is needed in order to get infected. So we were finding, and public health was finding, that even in fully masked individuals, and I'm talking good quality masks, surgical masks like a doctor would wear, they were still getting infected with COVID. So what you'll find is if you are in a workplace and even though you're all masked, if someone is COVID positive, public health will come in and they will send every single person who was within 2 meters home for 14 days. So you might find your entire business basically shut because you have no workers left. And so in order to help you keep open, we've added this requirement that if you have the eye protection on, you will not be required to self-isolate for those 14 days. And I'll be honest, this has even been relevant to us as our inspectors. Our inspectors are visiting workplaces in outbreak, And so if we didn't have the eye protection on, we would have to also stay home for 14 days. So this again is coming from public health, but it's still, a lot of people are shocked about it, and I'll make clear why. Unfortunately, the Reopening Ontario Act does not have that as a requirement. So a lot of people keep saying to me, Jules, where does it say that in the Reopening Ontario Act that you have to wear this eye protection? It unfortunately does not say that there. This is something that we consider a reasonable precaution under OSHA, and it does say it in public health guidance for contact tracing, but it doesn't say it clearly in the ROA. So I just really want to reiterate the importance of that. Next slide. Again, so again, the COVID key question, and I see the questions in the comments are coming, but what's the vaccination plan, and can you mandate vaccines and all that? So basically, any employer's policy on vaccination, must consider the Ontario Human Rights Code, but that doesn't mean you can't have a vaccination policy. And the Ontario Human Rights Commission actually just came out a few weeks ago saying that having a vaccination policy, including one that might say workers can't come to work if they're not vaccinated, does not necessarily contravene the Ontario Human Rights Code. But it is something like, as Sobi, you said it so well, probably talk to your own lawyer. It's the OSHA is silent, unfortunately, on vaccination. We totally encourage it. And in healthcare workplaces, it's actually required you have a plan. So we actually, if you're a healthcare workplace, we will say, what is your vaccination plan? But in other workplaces, we encourage it. And, like I said, it's something you should definitely work to encourage your staff. It is one of the best controls, obviously, for COVID. But if you have someone who isn't getting vaccinated, or you're not going to mandate vaccines, that's okay. Just use other controls. Like the key question, what's your safety plan? What controls do you have in place? So if we see that, there's no vaccination, we might say, well, what are you doing to keep people 2 meters apart? Are you using personal protective equipment? Those are the kinds of questions we would be asking. Okay. Next slide. Oh, sorry, last one. So just common contraventions. Really what we continue to see is workplaces that have not put thinking through about how to keep people 2 meters apart. They're not putting in place physical distancing. Now, you don't have to do physical distancing, but as soon as we see you're not 2 meters apart, that leads to us a bunch of other questions. Are you wearing masks? Are you wearing eye protection? Could you put plexiglass between these two people? We're going to ask all those other questions. So I would always suggest, first and foremost, look at your workplace and say, is there a way for me to keep people 2 meters apart? If so, do it. If not, that's okay, but then you're going to need to put other controls in place. And so really do that risk assessment piece. And then, really the best practices that we're seeing out there, which is, what are people doing that we've been impressed with, is really working with your Joint Health and Safety Committee, involving them in creating the workplace specific plan, really sharing information and encouraging participation from your workforce, getting that buy-in from them. Having workers work from home wherever possible is a best practice. We don't require it, but it definitely eliminates the risk. Obviously, keeping workers physically distant as much as possible when you can't, using an impermeable barrier. And then another key one, don't just think of COVID safety while you're making your widgets or serving your customers. It has to be, what are my workers doing when they're on break? What are they doing in the lunchroom? This has been an area of spread. So we've found workplaces are doing extremely well during the official quote unquote work hours, and then their workers walk into the lunchroom, take off their mask, and then COVID is spread. So that is another area our inspectors are looking at. And then, like I said, encourage as a best practice vaccinations. Okay, thank you so much. I'll pause there.
Thank you so much, Jules. That was great information that you have set out for all the people who have joined us today. And it is the employers and management team's responsibility to ensure that we keep our workplaces safe, and especially pandemic, it is our responsibility to focus on how do we minimize the workplace exposure. As we are reopening, and especially Tony can touch upon the restaurant side of things. I mean, healthcare has been serving and being in the front line, dealing with all kinds of issues. How are they protecting themselves? They have full gear on. And that is apart from vaccination and everything else, they wear their facial goggles, everything else. But when we talk about restaurants, I don't think we could maintain 6 feet in between when people go to pick up the plates, or to give the dishes, or whatever it is. So how are they going to protect themselves? And wearing a face shield and the goggles. These are some of the things that we really, really need to start thinking about. And we need to make sure this message goes out to the people who work in those industries. And as a community, as part of the ecosystem, it is our responsibility to keep on refreshing people, because we could all see when we go into places that as patios as opened, how many of them are actually wearing the face shield or the goggles? We see them wearing a mask. Mask has become a common thing, and everybody has accepted the mask. And I also do see people going out for walks without wearing a mask. At this point, my personal opinion, I don't think that's safe. But especially servers and people who are in the front line serving people, where they can't physically maintain the 6 feet clearance, they should be looking at the proper gears. And it is our responsibility to ensure that they understand the importance, and especially you touched upon the goggles. It is a new information. I know all of us were aware. When we initially found out from Ron, we went ahead and ordered safety glasses for everybody in the office, to make sure that, we get them to wear the safety glasses. So these are important points. And you did touch upon the Joint Health and Safety Committee being involved. Those small organizations who don't have a Joint Health and Safety Committee, make sure you have at least a couple of people in your organization who are well versed in the Occupational Health and Safety Act and the standards and what is expected, so that they could ensure that they're maintaining a safe and healthy work environment. That being said, let's move on to Melissa Faber, Director of Employment Standards. And Melissa, it's a great pleasure to have you. I'm sure many people are waiting to hear the latest and greatest updates and amendments that has happened within the Employment Standards Act. So let me do a quick intro. Melissa has spent her career with the Ontario government and has been with the Ministry of Labour, Training and Skills Development for the last 7 years. She was appointed as the Director, Employment Standards in fall 2019. Prior to being the Director of Employment Standards, Melissa worked in numerous ministries in senior roles related to regulatory policy, including labor and employment policy issues. Thank you for joining us, Melissa, and I will pass it over to you for you to take us through some of the details that everybody is waiting to hear.
So thank you for having me here today. I think I'm going to have a bit more of the dry subject matter as we go through some of the requirements under the Employment Standards Act. As I start, I think the first thing that I would say is, so the Employment Standards Act, as you are aware, covers things such as, wage rates, hours of work, overtime pay, vacation entitlements, vacation pay, etc. For the most part, there have been no significant changes to the Employment Standards Act, aside from some rules around termination and severance and some rules around job protected leaves. So the rest of the rules for the Employment Standards Act continue to regularly apply to how people are working and what they should be paid, what their entitlements to time off are, etc. I'm going to talk about the temporary rules that have been put in specifically to the Employment Standards Act today to give you a bit more of a flavor of what is there. So moving on to the next slide. The first one I want to talk about is the temporary rules that we have in and around termination, severance, and constructive dismissal during the COVID period. So this is a regulation under the Employment Standards Act that prevents termination and severance pay obligations that would have arisen during the COVID-19 period, where an employer temporarily reduced or temporarily eliminated an employee's hours of work or wages for reasons related to COVID-19. This only affects non-union employees. The changes apply during the COVID-19 period. So currently, and this has been extended a couple of times at this point, currently the COVID-19 period is March 1st, 2020, and it ends on September 25th, 2021. Any terminations or severances that occurred prior to May 29th, 2020 are unaffected by this regulation. So to get into a bit of the nuts and bolts of how this works, for termination and severance pay, under the ESA, if an employee is laid off for a period longer than a temporary layoff, the employer is considered to have terminated the employee's employment, and that employee would generally be entitled to termination pay, and in certain cases, severance pay as well. Under this regulation, an employee is not considered to be laid off if their employer temporarily reduces or temporarily eliminates their hours of work for COVID-related reasons during that period of March 1st, 2020 to September 25th, 2021. So basically, it means the layoff clock stops ticking towards becoming a termination of employment during this period. The second piece that this regulation affects is constructive dismissal. So under the Employment Standards Act, a constructive dismissal may occur when an employer makes a significant change to a fundamental term or condition of an employee's employment. For example, significantly reducing the hours of work or wages that the employee would be earning without the employee's actual or implied consent. So that's kind of the high level, how the constructive dismissal provisions work. So in order for a constructive dismissal to occur under the ESA, the employee would then have to resign in response to the change within a reasonable period of time. And that could then be considered a termination of employment for purposes of the ESA. Under the regulation, an employee is not considered to be constructively dismissed if their employer temporarily reduces or eliminates their hours of work or wages for COVID-related reasons during that March 1st, 2020 to September 25th, 2021 period. During this period, non-unionized employees are deemed to be on unpaid infectious disease emergency leave, and that'll be the next piece that we talk about, when they are not performing the duties of their position because their employer has temporarily reduced or temporarily eliminated their hours of work for those reasons. So moving on to the next slide, we'll talk a bit about leaves of absence during kind of the pandemic. So one of the first changes that was made back in March 2020 was around job protected leave for those who might need to be absent for reasons related to COVID. So there are a number of job protected leaves underneath the ESA. I'm going to speak specifically about the one that has been created for COVID-19 and other infectious diseases that might occur in the future. So I'm not going to touch today on sick leave, pregnancy leave, parental leave, family caregiver. Each of those leaves is different, and the purpose of the leaves, their length, eligibility criteria do vary. At the end, I do have some resources that are available, but if you're ever looking for more information about the Employment Standards Act, you can visit ontario.ca/ESA guide. So the two that we're going to focus on today are unpaid infectious disease emergency leave and paid infectious disease emergency leave. So unpaid infectious disease emergency leave is retroactive to January 25th, 2020. In order to qualify for this leave, there's a number of different reasons that could be taken. An employee does not qualify for the leave solely because they're concerned that they might get sick. It's only available if an employee is not performing the duties of their position for specific reasons related to COVID-19. These include the employee being under medical investigation, supervision, or treatment related to COVID-19. This would include being tested for COVID-19, receiving a vaccine against COVID-19, any side effects that might occur from the vaccine. If the employee is unable to perform the duties of their position because of a public health order under Section 22 or Section 35 of the Health Protection and Promotion Act. If the employee is in quarantine, isolation, or subject to a control measure in specific circumstances. If the employer has directed the employee to stay home because they are concerned the employee may expose other individuals in the workplace to COVID-19, to provide care and support to certain family members, and also due to certain COVID-19 travel restrictions that result in a situation where the employee cannot reasonably be expected to travel back to Ontario. One of the things that is, for a reminder on this one, is that while you can request reasonable proof of entitlement at a time that is reasonable, there is no ability to require employees to provide medical notes from a physician or nurse to prove that they're eligible for the leave. There's also no limit on the number of days a qualified employee can take the unpaid infectious disease emergency leave. The second leave that we have is the paid infectious disease emergency leave. So this was added on April 29th, 2021. It's retroactive to April 19th, 2021. So employers are now required to provide eligible employees with up to 3 days of paid infectious disease emergency leave because of certain reasons due to COVID. An employee who qualifies for paid infectious disease emergency leave is entitled generally to be paid what they would have earned had they worked and not taken the leave, up to a maximum of $200 per day. Eligible employers can apply to the WSIB to be reimbursed for these payments. This leave continues until September 25th, 2021. And similar to unpaid infectious disease emergency leave, employers cannot require employees to provide medical notes to prove that they'll be eligible for the leave. In order to qualify for this paid leave, employees must be taking the leave for the specified reason, and they must not have certain entitlements under the contract of employment. So when you're looking at that comparison, you will need to look at April 19th and what entitlements the employee still had. So if as of April 19th, an employee had, so if you provide 5 paid sick days for your employees that could be used for, side effects for the vaccine or because you were ill due to COVID. And as of April 19th, that employee had 3 of those days left, then their entitlement to paid infectious disease emergency leave would generally be reduced to 0. If that employee had already used all of their paid sick days already, then they would have entitlements to 3 paid days. There are kind of 4 criteria that need to be met. There is more information that you can find in the ontario.ca/ESA guide that will help you work through what that looks like. The reasons that an employee can take paid infectious disease emergency leave are similar to unpaid, but not exactly the same. So it's a smaller set of reasons. So it's if the employee is under individual medical investigation, supervision, and treatment related to COVID-19. Again, this includes receiving a vaccine, vaccine side effects. If they're subject to an order under Section 22 or 35 of the Health Protection and Promotion Act, if there is a concern by the employer that the employee may expose others in the workplace to COVID-19, if the employee is in quarantine, isolation, or is subject to a control measure, and then to provide care and support to certain family members because the family member is either under individual medical investigation, supervision, or treatment related to COVID-19, or is in quarantine, isolation, or subject to a control measure in certain circumstances. So moving on to the next slide. I just want to speak a little bit about the COVID-19 worker income protection benefit. So this is the reimbursement program for employers that has been put in place to reimburse up to $200 per day related to the paid infectious disease emergency leave days that have been taken. So in order to be eligible for reimbursement, the employee has to have taken one of those paid infectious disease emergency leave days. Employers must make an application for the reimbursement to the WSIB within 120 days of the date that the employer paid the leave. For this one, if you would like to learn more information, including how to apply, as well as a link to the application portal, you can go to ontario.ca/COVID worker benefit. And then finally, moving on to the next slide, always like to just provide a few areas where you might be able to provide some more or find some more information if you're curious about things under the Employment Standards Act more generally, anything to do with these specific leaves and requirements. You can see here, we have very robust information in our ontario.ca/ESA guide. I know I keep saying that one. If you are looking for anything regarding the worker income protection benefit, you can go to ontario.ca/COVID worker benefit. And there's some additional pieces here too. We do webinars to provide some additional information as well. If you want to see what webinar offerings we currently have, you can go to ontario.ca/ESA tools. Okay, thank you.
Thank you so much, Melissa, for that. It's a lot of information. I'm sure many employers who have logged in or managers are looking at it going, I want more information. Can you give us some reference where we can get more details? So there has been many questions that have been posted. And we are running behind schedule by at least 15 minutes. So we do have Tony next. And then we'll be taking up some of the questions. I know Ron has managed to answer some of the questions. So thank you so much, Melissa, for all the details on the employment standards and the amendments to it. It is great to know how the government has taken the initiative to support as much as possible while we are going through this difficult time with the pandemic and keeping workplaces safe. So I'm going to pass it on to Tony Elinas, the President and CEO of Ontario Restaurant, Hotels and Motels Association. The association is the largest provincial hospitality association in Canada, representing approximately 4,000 members and 11,000 establishments in the hospitality sector. Tony was appointed in this position in April 2008. Tony is an Ontario hospitality leader with over 35 years of industry experience and a proven track record of positive contributions to the hospitality and management. Tony sits on the board of directors for the Hotel Association of Canada, and industry board includes the Ventures Quality Alliance. Tony is a participant with the Hospitality School and government-related advisory and steering committees. Thank you so much for joining us today, Tony and Fatima from ALTMA, and I'll pass it on to you now.
Thank you, Sobi, and Melissa, Jules, and Ron. Great to be on this session with you. Good morning, everyone. Good morning to all the attendees. It's always been a pleasure to be with industry leaders, and even though it's virtual, we cannot wait. Definitely much better when we meet face to face. And let's look at this. Today, we have vaccination success, and soon we'll be together, no doubt about it. Step 2 is rolling out this Wednesday, June the 30th, and it won't be long till we meet in sessions like this on face-to-face in our hotel meeting rooms. I was asked to give you an overview of the climate in the industry and the priorities. So when we look at hospitality operations, COVID-19 has shifted the definition of success to survival. Just keeping the lights on spells enormous achievement, and illustrating a financial performance in an industry that is hurting, it is really, truly depressing. We have estimated over 15% of Ontario's restaurants are now closed. 8 out of 10 restaurants are operating at a loss. The majority that are open cannot borrow any more money. Both hotels and restaurants are expecting a 2-year recovery period. Many will need much more. Overall, travel and restaurants have been locked down in Ontario much longer than any other jurisdiction. Our current opening concerns are the announced scaling down of the federal wage and rent programs in a business sector that will need a longer recovery road, unlike other businesses that are progressively recovering. Though outdoor patios are open, these represent a fraction of operational restaurants. In Toronto alone, around 1,200 patios are open, and they've done a great job with Café Tio and expansion of the patios right across the province. This is exciting news. But in Toronto, there are 8,000 restaurants out there. What about the rest? An immediate need is to know of the capacity and restriction standards under Step 3 for opening Ontario. There are no details for indoor dining, nor meetings and events, which need a longer booking window to reserve business. Indoor rooms have been much scrutinized during the pandemic, and we want to ensure the industry opens safely, but opens without punitive capacity restrictions. Furthermore, we require a cohesive plan of how the vaccination controls will transpire at international border points and when entering a business. And that also goes with rapid testing. Pre-COVID workforce was the biggest industry issue. And as demand grows, Canada as a country will see it return, but much more severe, specifically in the hospitality industry. It's the same old story. Baby boomers exiting the workforce, less youth into the workforce, and even less in hospitality. COVID-19 has painted the industry unsafe and also a dead end when it comes to careers. We all know Canadians don't want to work in the various jobs we have, and immigration policies are not friendly to this industry. We have been corresponding and meeting with the federal ministers of immigration and employment, but the high recorded unemployment numbers have been against us. It is a challenge. The USA is facing severe workforce issues, and we are hearing about filled positions in Ontario's resorts hotels and in outdoor patio openings. It is evident the largest centers where the cost of living is higher, such as in the city of Toronto, have seen many employees opting to leave the city to more affordable destinations, perhaps back home where they were born, adding more pressure to the overall hospitality workforce issue, including constant training and development. I'll now reflect on how ORMA has supported hospitality under these extreme and unprecedented conditions. Back in the first wave, our ORMA team practically overnight developed a COVID-19 resource website labeled Dine Safe, educating all on the safety and health rules and best practices, along with the ongoing government communication protocols from both the province and the local health departments. We've spearheaded a campaign to ensure the industry understands and knows where to go to find the information. All government safety protocols were replicated and housed on the dinesafe.ca portal, including every single public health unit's rules. I compliment our team in keeping up with 34 or so health unit updates. It has been a challenge. The emails and phone calls from our members have not stopped to this day. Many inquiries and many questions, and rightfully. There have been so many new rules, and in some cases, difficulties in interpretation of the rules, and some important details missing altogether. It is and has been one of our busiest tasks to ensure we obtain answers to our members, no matter how tough the inquiries might have been. After all, we are in the service industry. This pandemic started out as a health and then an economic crisis, and came to be an emotional crisis. Early this year, in the middle of the shutdown, we sent out a survey on mental health. We received the fastest and highest survey responses in our organization's history, with 94% responding they needed some type of mental health support for employers and or their employees, with some needing a one-to-one conversation. We followed through and partnered with CAMH, developing a series of webinar conversations along with the necessary tools. And we focused on mental health. We continue to do so. So now, with the opening of outdoor patios and soon indoor rooms, we have been working with the Ministry of Labor and Forest to provide industry with resources to ensure restaurants operate safely while meeting COVID-19 compliance rules. We are excited to be working on this project. We develop a menu of relative education and information items. starting with a facelift of the dinedsafe.ca portal, where it will house all the resources. A reopening video, making it simple and fun to understand the roles and responsibilities that we've heard in this session today. Webinars covering ESA and safety-related rules, as the employer reimbursement program, sick day rules, and safety plans as examples. In addition, a project will include a series of industry outreach components. We are grateful to the ministry for supporting us to support the industry and to have 4S, which we know is a capable partner. Ladies and gentlemen, hospitality operators have been locked up too long and are anxious to open and stay open. The vast majority of operators have invested effort and money in implementing and following the safety protocols, and they wish to comply. We realize that there are many that have not implemented certain protocols and that there are inconsistencies out there. We aim to fix this. With our recent ministry and forest outreach initiative, we aim to raise much higher awareness and support compliance for a safer hospitality operation. Thank you to all, and have a great day.
Thank you so much, Tony, for sharing some of the challenges, opportunities, as well as solutions that OLMA is facing, and continue to provide support to the hospitality industry, especially the restaurants and hotels who's being affected the most with the pandemic. And you did touch upon some of the resources that you have available, and I know with ministry support, there's going to be amazing things that's coming out with the safely reopening initiatives, with the video and the sessions on the safety plans. That being said, I do want to kind of expand a little bit before we go on to Q&A in terms of all of us are leaders here, either directly or indirectly or part of our organization. It is all of our moral responsibility to ensure the places that we go to, especially our workplace as well as places that we visit, that they follow a safety protocol. If you go into a restaurant or a retail shop, just make sure that people are following the safety protocol. If they are not, then do approach them and convey your concern, and also go over some of the requirements, or escalate that, because we all are morally responsible for ensuring that we all come out of this lockdown and safely reopen and continue to stay reopened, and to control the spread of this virus. So that being said, there has been many questions. I know we have over 20 questions in the Q&A, and Ron and Melissa have been answering as much as they can on some of the questions. So those of you who have put the question, some of you have got the answers while others are waiting for it. And I do want to take the opportunity to thank the Forest team for working together to bring all these officials together to give the right context to the various different workplaces that have joined us today, because our intention at Forest is working with employers to maintain a safe and healthy work environment. And it is not a band-aid solution. It has to be a sustainable solution. It has to be part of our organizational culture. So please focus on making sure your employees have the right training, the right context. It is an internal responsibility system, so everybody is responsible. But leadership needs to take some of the initiative, and under the Occupational Health and Safety Act, it is the law. So you do need to have a health and safety plan. You do need to have your health and safety program in place if you have 5 or more employees regularly employed. So it is our responsibility to maintain a safe and healthy work environment. That being said, let's move on to some of the Q&A that is being posted. One of the questions that I see that they haven't got the answer, it was a couple of times repeated, is about safety glasses. This goes to Jules. Jules, if you can kind of expand on the safety glass, has it been an amendment or is it a recommendation? Where can they find the information? If you can do that, we would greatly appreciate that.
Yeah, no, absolutely happy to answer that. So there's two different requirements. And so I'll speak first about the Reopening Ontario Act. So the Reopening Ontario Act very explicitly speaks about what restaurants have to do. So it says that servers who are so let me step back a minute. Obviously, if I'm in a restaurant, I'm a patron having food and drink, I have to take my mask off. So I'm an unmasked individual. Someone may not know whether I have COVID or not. The individual themselves may not know. And the servers have to come within 2 meters to bring the tray of food and the beer and whatever they're drinking, the coffee. And so it's a requirement under ROA that if you're within 2 meters of an unmasked person, you are required to wear eye protection. And when we say eye protection, it has to be like safety glasses that have side protection as well. So we're not talking about regular eyeglasses. It does not need to be, and just for clarity, we're not, safety glasses that you use in a factory setting, they work perfectly fine, but we don't care about the impact resistance. It doesn't need to be able to, stop shards of metal flying at your eye. It's about protecting you from droplets. So it's really just about having that protection. So regular eyeglasses where you attach side protectors can work as well. But then under OSHA, as I said, we've had to modify what we consider reasonable precautions in the circumstances to go even stricter than this. And this is based on public health finding that the variants of concern were spreading even in places where people were masked. So if you are, as part of your work, expect you'll be within 2 meters of somebody, so it's considered reasonable to say, yes, part of my job requires me to be within 2 meters of a colleague or 2 meters of the people I'm serving or working with or the clients, then you're required to wear eye protection. If you don't want to wear eye protection, this is the simplest thing. When workplaces say to me, are you kidding me? I say, you don't have to if you keep 2 meters apart. You also don't have to if you put a piece of plexiglass up. So you've seen a lot of grocery stores, they've got a piece of plexiglass between the cashier. They don't require eye protection either. But if it's considered that part of my role brings me within 2 meters of people, then you need the protection with side protection as well. Importantly, and I want to make this clear, we're talking about being reasonable. So if someone walks past you for like a few seconds, that is not considered, working within 2 meters of somebody. We're not talking about transitory passes. Someone walked past you on the sidewalk or something like that. It's about my role, my job requires me to work within 2 meters of somebody. And so, that's what we're talking about, just for that clarity. And so it is on ontario.ca. If you look at our guidance, and we can send a link afterwards if you would like. But basically, we've made it clear when it's required. And like I said, it's not required if you wanted to step back the 2 meters. So the other piece is this: if you have people working in a vehicle together, they're by definition less than 2 meters apart. You need to consider that as well, because they're going to need to have that eye protection on as well. Now, I'll be honest, this is to do with the variants of concern, this is to do with spread, and this is to do with advice from our colleagues in public health. Will you have to do this forever? Obviously not. We're getting to higher vaccination rates. We're getting to what we hope to at some point be herd immunity. And so we're waiting on guidance from public health when they no longer consider this a high risk exposure. It's based on them saying that being within 2 meters of someone without eye protection is high risk. And so when they back up on that, we will then take it away and not consider it a reasonable precaution. But for now, if you don't want to have a nasty surprise of public health during contact tracing, shutting your business down by sending everybody home for 2 weeks, this is a way you can stay open. And so we've seen factories where they shut entire lines down. We've seen entire workplaces sent home, and the employer was just completely taken by surprise. So this is really, I know it can seem onerous, but it's really actually about how can you stay open, because it's devastating to have public health show up and send everybody home for 2 weeks. So if just to reiterate, keep 2 meters apart, put plexiglass. If you can't do those, you have to have the eye protection on.
Hi, Jules. We've been hearing confusion among many Ontario regions where the local health unit inspectors do not communicate this rule, and do not enforce it. And in many cases, letting the operator know that this is not a standard. I received 3 calls this week just on this rule.
Yeah. Tony, I get calls all week long about this, and I'm sorry, it is frustrating. And this is a bit of the challenge we have with 34 public health units. I'm just going to be honest. We do not have a consistent message. We keep reiterating with our public health colleagues at the provincial level, but also at the local level, that we need to be on the same page. And we've been trying to fix that issue, because we've got exactly the situation you're saying, where some public health units are saying, no, I don't require that. We've got others who have gone even farther. They're requiring airtight sealed goggles, like that you could literally not, like, I'm talking like fully sealed, like gas mask style goggles in some of the public health units, including a few up north. And so they're saying that just the regular safety glasses I'm talking about isn't enough. This has been a frustration, and we're trying to get consistency. All I can say is that, like, from the provincial level, we're working on that. We're trying to get that consistency, but we've got a zone where each medical officer of health is their own power and their own bailiwick. So I understand your frustrations, and we'll keep sending the message out about that consistency with our colleagues.
We'll do our part, especially with this initiative.
Yeah, thank you.
Thank you so much, Jules, for expanding on that, because that really needed some clarity, because a lot of people are confused about the safety glasses or the face shield. So thanks for expanding on that. And especially Olma, I'm sure that they're going to do a great job in conveying that message to the hospitality industry. In regards to questions, there's quite a bit of questions. Some of them have already been answered. So I'm going through the questions that have yet not to be answered, and to see how we can give you the right context or the answer for it. There's a question from Corinne. Is there a suggested template for a vaccination policy? Where to find what is recommended in creating such a policy? In my understanding and participation in many of the association committees, various different associations have come up with standard templates for vaccination policy and rapid testing. I know the OGCA, Ontario General Contractors Association, was working on a very detailed policy as a template to share with their members. Many other associations have such templates. So if you are part of an association, do ask them to share that. They do have quite a bit of seminars that happens on the various different topics addressing some of these issues. That being said, there was another question Satish has posted. Since Ron have to leave for another meeting, I don't know, Jules, whether you have the answer for this. Trained representative in workplaces, kindly provide us with the website information for this training. I believe they are talking about health and safety representative training. So Jules, do you have any information to provide?
Yeah, no, absolutely. We can circle back and provide you information on that. As you know, like Joint Health and SOBI, you guys are an approved JHSC training provider, but we don't have approved training providers at present, or because it's not required for health and safety rep. But we've realized a lot of those smaller businesses are looking for support. So we do have some supports with regards to if you have health safety reps, so if you're 6 workers to 19 workers, and we can send out a link to you about that afterwards if you're interested.
Perfect. Thank you so much for that. And one of the things we do tend to take it out to all of our clients. Our clients vary from various different categories, different sectors, size, and nature. And one of the things that we do tell our clients is have more people trained in Joint Health and Safety Committee. When you have a larger committee, even if you're under 20, it doesn't hurt for you to invest the time and resources to have at least 2 people train, 1 manager, 1 worker. They will sit through the training. There's various different options available, especially during the pandemic. You know, now with the online e-learning, it's 15 hours of e-learning for part 1, or they could attend the virtual training, which is 3 days for part 1, and they do have to do the Hazard Pacific part 2, which is 2 days. This will give them the insight into the employer's responsibilities and how to identify hazards, control hazards, keep the workplaces safe from proactive measures by doing inspections, and then investigations, learning from that. These are great training that I would highly, highly recommend many employers to understand and put more people through it. If you do have a committee, expand your committee. And get more resources. So this way you're not dependent on 1 or 2 key individuals. You have a team of people who are going to be supporting with these additional responsibilities and initiatives that's required to keep the workplaces safe as we are reopening and bringing people back into the office or the workplaces. So that being said, we do have time for 1 or 2 more questions. I'm just going through the questions to see any other questions that have not been answered. There's one, I'm pretty sure, Melissa, if you haven't answered, this has popped up in a couple of different questions. Do workers have 5 sick days available? Use those days before using the 3 emergency leave days. And should the 3 unpaid ideal days be granted before the 3 paid days? So maybe if you can expand on that, Melissa, to give the right context.
Okay. And I will try to do my best without becoming too technical. So the first thing that if you have contractual days, the first thing you have to do is determine for each employee whether or not they do have entitlements to paid IDL days. So you have to look at what that employee had on April 19th, 2021. So if on April 19th, 2021, if they had contractual obligation or contractual entitlements that they had not taken, or whatever number they had not taken, those would then potentially be counted. Then you have to look at whether or not those contractual entitlements would cover any of the reasons that you could take the COVID leave. So for example, if you had floater days that could be taken for any reason, that could be a contractual entitlement that would draw down how many paid IDL days there were. If you have paid sick days, then similarly that could be used for, being ill due to COVID, therefore it would draw it down. Then the next piece of the assessment you would have to do is determine whether or not that is being paid at the same amount that the paid IDL has to be paid. So in some contracts, if it's a sick day, maybe you get paid at 75% pay. For paid IDL, you need to get paid what you would have been earning otherwise, up to a maximum of $200. So you might have to make that calculation to figure it out. In some cases, that 75% might get you above the $200, and so that day would draw down a paid IDL day. Then the final thing that needs to be considered is whether or not your contractual entitlements have any provisions on them that would make them more restrictive than your paid IDL day. So examples that might be more restrictive is if you have some day that's available for your employee and they have to give you prior written notice and approval in order to take that day, that would be more restrictive than the paid IDL day. So if you have those days that meet those criteria, you would make that calculation to determine how many. So like if you had an employee who had 1 paid sick day left and they met those other criteria on April 19th, they would have the contractual entitlement to 1 paid day under your contract, and then they would have 2 paid IDL days. So then the next question is, do they have to take their contractual day first, or do they take the paid IDL days first? Generally, our position would be that the employee makes that decision. There might be reasons that they want to take one versus the other. For example, if the contractual entitlement was a paid sick day and they needed the paid IDL day in order to take care of a sick family member, then they might want to take that paid IDL day instead because they can't take their paid sick day. And then the final question I think that was in here is, do they take the paid IDL day first or because they would also have unpaid IDL that they could have access to. So generally the default in the legislation is that the employee would take their paid IDL day first. However, employees do have the ability to elect in writing to take that as an unpaid day. And they may wish to take that as an unpaid day because it could affect their access to certain federal income support benefits if they take a paid day from their employer. So if the employee makes that election, they must do so in writing before the end of the pay period in which they took for the day that they took. So that's a lot of information. In my written responses, I do refer people back. We do have examples in our ontario.ca/ESA guide to go through, how you make that determination of how the contractual entitlements work versus the paid IDL entitlements. And there's also information in there as to how the unpaid and the paid work together. So I hope that answers that question for people.
Thank you so much, Melissa. I know it is a new and an interesting topic and needs a lot of clarity. So thanks for taking the time to expand on that to give clarity to people. For those of you who we haven't answered any other questions, your questions are not going to be ignored. We are going to be actually trying to get the right answers for you and reach out back to you with the proper answer based on the question. And before we close off, there's one question that popped up. Is there any update guidance on cleaning and disinfecting protocols in the office and on construction site? I know based on my understanding, I'll wait for Jules to answer, but there was a free training that we did put together. I don't think there has been much changes to that, but it goes over all the various different cleaning, disinfecting protocols in an e-learning manner. It is free through the Forest website. So if you guys are interested, seek out to us and we will assist you as much as possible. Jules, if you can expand on that, we would greatly appreciate it.
Yeah, I mean, I think you've answered it quite well. So all I can say is as we've gotten this far into the pandemic, realize that obviously cleaning and disinfecting is always important, but fomites, which is what we call the spread of infection via touching surfaces, is much less of a risk now that we have more data and science in. Doesn't mean it's not a risk, but basically whatever standards or protocols that were put in earlier are definitely good enough. We've not needed to go to a higher standard because we've realized that fomites are less likely a risk. So regular cleaning and what we call enhanced cleaning, cleaning more often than you used to pre-pandemic, using a proper cleaning supplies, as is already in the Forest course or other resources that are out there, that will help you meet those requirements.
Thank you so much, Jules. And I do want to take the time to thank all the panelists. I know Ron had to leave for another very important meeting. It is a great pleasure to have Melissa, Jules, Tony, Fatima join us today to give the insight to many participants who have joined in. I believe we had over 150 and we have gone almost half an hour past and still we have close to about 100 odd participants who stayed back to get all the answers. Thank you so much. This really helps us to give the right context to workplaces to safely reopen. And I'll pass it over to Addy for closing.
Thank you very much, Sobi. I really admire the effort put in by both the industry partners of Forest as well as the government partners. Thank you so much for getting this together. This is invaluable information for all the participants. I'd like to actually take this opportunity to let everyone know that whoever is on this call, stay tuned. On July 22nd, Forest is doing another very big webinar, and it's on path to OHS accreditation and safety programs, something that employers might not want to miss because there is a lot of information that will be shared by the government panelists who will be there with some of them from the industry as well, talking about where you are in your OHS roadmap and where you need to be and what you can do and what are the options for rebates, if any, through WSIB Excellence and much more through ISO core. A lot of things will be discussed. So stay tuned for that and we will connect with everyone in that regard. Also, if you felt that this was insightful, the session, because it means a lot to us, whatever you say in your feedback. Okay, if you felt it's insightful, please help us with Google reviews. Your Google reviews will help more and more people and employers connect with us and take advantage of these kind of webinars and get the information and the perspective, especially what Melissa spoke about, and even Ron and everyone. Thank you so much. And we are here for another minute. If there's any further questions, if not, if you have any questions, my contact details are right on the screen. You can connect with me using those contact details. So, Sobi, is it time to call it a day?
Thank you so much. Yes, it is, because we have gone half an hour past, and thank you so much to all the panelists and all the participants. Let's keep our workplaces safe as we reopen. Thank you so much, and let's have a safe and awesome day. Bye for now.
Everyone stay safe and stay well. Bye-bye.